look at health systems, and I'm very glad to have heard of the presentation yesterday, the message is coming even more and more frequent in terms that we need to look at the health systems from a comprehensive point of view, not only from the health financing point of view, because health financing is not something apart, it's not something separate, it's completely entangled and embedded in the other functions of the health system.
Suicides. I just put that there to indicate, because in this question of suicide, now the reason I'm using the suicide, just to mention it, Trinidad and Tobago has a very high rate, and another Caribbean territory is supposedly supposed to have one of the highest rates in the world. The reason I'm mentioning it is because if you think of the mortality figures I presented, the only thing that you would see really in mortality is things like suicide. But if you look at the burden of diseases, it is a major problem.
The politicians, you know, this is the thing that they like to do, these hospitals, and they will do it because they believe that that's what people want. So it is our business to educate our populations, you know, that hospitals are not the answer to our health problems in this region. The populations have to understand that, and then the politicians are going to get the message.
You go to a hospital, the doctor or the specialist, they decide what to do with the patient without the insurance company having nothing to say, just to pay the bill. So what we do, we work together with the specialists in order to assure treatment pertinence. With that process, of course, we provide rational use of resources, and we determine the hospitalization of the patient. We don't provide that the patient get hospitalized just for the sake of it. They go through a process that we have created with a tool called PRU.
If you look at the trend year in and year out, it's the same trend. My question has always been, if we know when they're coming, why don't we do interventions right before we have the epidemic? We have the information. Sometimes we don't react in an opportune time for various reasons, and that also reflects a systemic problem within our ministries in terms of governance, performance-based assessments. So people only, when you have the cases, then you start spraying. I'm saying no, you know when it's coming, start spraying before.
I have been trained in Amsterdam, and in the hospital we had a very well-known European New Drugs Development Office working on new cancer drugs at that time, and that is a very expensive part of healthcare nowadays. Still, the primary care and the hospital care. You can see that medical specialists, as well as in Holland as in Curaçao, and the other islands, I guess the same, are moving more from independently established specialists into being more part of the hospital. And that's a very interesting thing.
The reversal of population phenomena, which will have serious implications for pension reform and even the whole question of how we are going to finance our public health services. Because what is going to happen is that you have a larger percentage of your population being over 65, which means that a smaller percentage are going to have to bear a larger chunk of the burden, and the question of ability to bear would come into play at this time.
Because we can leapfrog. Leapfrogging is using innovations, new technologies, new operations, or new ways of working in such a way that we can have much faster progress than the developed economies have at this moment. For example, mobile banking is much farther developed in Africa than it is in the United States, just because of the need and the availability of the technology.
How can I deliver better than my customers? And also, how can I be unique in my area of product or service delivery? And this becomes very important in a very competitive market. If it's a small economy, many times that only has a single player in the market, you find that innovation may not come quickly. So in the classic case in the Caribbean, Cable and Wireless existed. Everybody knows Cable and Wireless from
many moons, Digicel came in and changed the ball game completely, forced them to innovate, forced them to derive, forced them to deliver new products to their competitors, and also, in both cases, they're trying to be unique in what they deliver.
The old system, because of this importation and as the system got older and needed upgrade, there were higher numbers of inconsistency activities that needed to be validated for payment, and that was a long process as well. The RAWA payment process is now simplified and a number of activities to be validated significantly reduced.
We managed to get where we are now, but we hope to improve, and we are working on it right now to at least get some of the systems better integrated, get one provider deliver several services for us. With that, we hope to achieve things like this. We hope to improve both the services to the care providers and to the insurees. Of course, we hope to improve our own organization, how we do things, how we don't do things, how we analyze our data. We hope to be able to be more flexible on changes that go on or changes that we want. And it's helping us getting more insight through our data, the data base, the data warehouse that we are creating from the different databases, as I just learned earlier today.
See the progress that has been made, because I've been attending these on a regular basis since about 2012, and the enormous progression that we have made. It is tremendous what all of these islands have been putting together in scientific knowledge, but also in the degree of wishing to cooperate with each other and to sustain each other, to advance in all ideas of how we can make public health care sustainable.
Well, you know, I have to say I'm very pleased because having been, I've been coming to this conference for the many years, and I think two people mentioned it today. The conference this year has gone to another level. I think I identified when I opened by reminding us that health financing we're talking about is not just about raising money, but about getting the system to work better for everybody and so improve the quality of life.
I was surprised because it was also said on the meetings that this year's presentations, is better quality than the conferences before. That is because probably, some more effort was put into it, and also the problems that occur now entails all of us. So actually, yes, I have enjoyed the meeting. I think we have learned a lot. The idea is to share the experiences with each other, because we are facing the same problems.
This is my third participation in this event, and I was very surprised at how the discussion is going and the interest of the people involved in the presentations and the countries and the key performance indicators that they are putting in place to measure the quality of the healthcare. So I'm really impressed with the quality of the conference.